Doctor, you mentioned congenital tumor? Yes, a slowly growing, highly invasive tumor, for example, a dermoid or teratoma. Doctor, the medulloblastoma is what? That is a highly malignant cerebellar tumor which metastasizes freely to the subarachnoid space, cerebrum, and cord. Doctor, what is the meningeal tumor? It is a neoplasm arising from the covering membrane of the brain. And a metastatic tumor? A metastatic tumor is most primary tumors are, that is, may metastasize to the brain, especially breast and lung tumors. What about the pituitary tumor? The pituitary tumor arises from anterior pituitary, that is, adenohypophysis or hypophysis, and may compress the normal portion of the pituitary, the hypothalamus, and the optic chiasm. Doctor, what is the primary brain tumor? I said chiasm, I meant chiasm. It is a comprising of the large number of intracranial tumors, especially the gliomas, which contain malignant glial cells. Some neoplasms of the glioma group are presented. Doctor, what is an astrocytoma? An astrocytoma is a slowly growing tumor containing astrocytes that infiltrate widely into neighboring brain tissue and may undergo cystic degeneration. Doctor, you mentioned an ependymoma, that is, ependymoma. Yes, a tumor arising from the lining of the ventricular wall is highly malignant and invasive. What about the glioblastoma? The glioblastoma multiforme is the most malignant glioma, rapidly growing, causing edema and necrosis of the brain tissue. Finally, doctor, oligodendroglioma. Oligodendroglioma is similar to astrocytoma in behavior, different in histologic structure. And cerebral concussion, that is the transient state of unconsciousness following head injury immediately as a result of damage to the brain stem. What is cerebral palsy? Cerebral palsy is a condition characterized by paralysis, incoordination, and other aberrations of motor or sensory functions due to pathology of the brain. Doctor, cerebrovascular disease, that is, any disorder in which one or more of the cerebral blood vessels have undergone pathological changes. And cerebral aneurysm, that is an intracranial aneurysm, a dilation of an artery of the brain resulting in a thinning and weakening of the arterial wall. Common locations are the internal carotid and middle cerebral arteries. Rupture and hemorrhage may occur and cause serious brain damage. And cerebral arteriovenous malformation? You are referring to structural vascular defect generally found in young patients with recurrent subarachnoid hemorrhage and epilepsy. What about cerebral atherosclerosis? That is a primary degeneration of the intima by atheromatous plaques. The lipid deposits, which usually are located in the basilar artery, the middle and posterior cerebral arteries, and at the branching of the internal carotids. The subsequent narrowing of the vessels may lead to inadequate oxygenation and nutrition of the brain by the reduced cerebral circulation, brain softening, neural atrophy, and senile plaques, and further damage and predisposing to physical and mental deterioration. Doctor, what is a cerebral embolism? A cerebral embolism is a sudden occlusion of a cerebral blood vessel by a circulatory embolus composed of air bubble, blood clot, fat cells, or bacteria. And, Doctor, cerebral infarction, that is a local necrosis of the brain tissue due to loss of blood supply in the part by an obstructed end artery. And cerebral ischemia, that is an anemia of the brain resulting from diminished cerebral blood flow. Some important causes are circulatory obstruction of the intra or extracranial arteries by atheroma, thrombus or embolus, severe hypotension, arteritis, or stenosis of an artery. Recurrent ischemia episodes are thought to signal impending stroke. Doctor, you mentioned in your hospital record a cerebral thrombosis. Yes, the formation of a thrombus within an intracranial artery leading to its occlusion and subsequent necrosis of the area supplied by the thrombosed vessel. Doctor, what about cerebrovascular accident, stroke, apoplexy? Yes, those are neurologic disorders caused by pathological changes in the blood vessels of the brain, primarily by arteriosclerosis, thrombosis, embolism, hemorrhage, or by arterial hypertension. A softening of the brain tissue may occur in the affected lesion. The neurologic deficit is characterized by coma, paralysis of one side of the body, aphasia, and convulsions.
Too fast. That's tough.
Take it again. Okay. Alan called me up. You need more timed out? I said, hold off. I got about 300 of them. The drug is injected, then moves into small blood vessels, capillaries, and is carried away by the bloodstream or reaches the bloodstream through the lymphatic vessels. Protein drugs that are large in size, such as insulin, usually reach the bloodstream through the lymphatic vessels because these drugs move slowly from the tissues into capillaries. The subcutaneous route is used for many protein drugs because such drugs would be digested in the digestive tract as if they were taken orally. Certain drugs, such as progestin, used for birth control, may be given by inserting plastic capsules under the skin subcutaneously. This route is rarely used. The intramuscular route is preferred to the subcutaneous route when larger volumes of a drug product are needed. Because the muscles lie below the skin and fatty tissues, a longer needle is used. Drugs are usually injected into muscle in the upper arm, thigh, or buttock. How quickly the drug is absorbed into the bloodstream depends in part on the blood supply to the muscle. The sparser the blood supply, the longer the drug takes to be absorbed. The blood supply is increased during physical activity. For the intravenous route, a needle is inserted directly into a vein. A solution containing the drug may be given in a single dose or by continuous infusion. For infusion, the solution is moved by gravity from a collapsible plastic bag or by an infusion pump through thin, flexible tubing to a tube or catheter inserted in a vein, usually in the forearm. Intravenous administration is the best way to deliver a precise dose quickly and in a well-controlled manner. throughout the body. It is also used in irritating solutions, which, if given by subcutaneous or intramuscular injection, would cause pain and tissue damage. An intravenous injection can be more difficult to administer than a subcutaneous or intramuscular injection because inserting a needle or catheter into a vein may be difficult, especially if people are obese. When given intravenously, a drug is immediately delivered to the bloodstream and tends to take effect more quickly than when given by any other route. Consequently, doctors closely monitor patients who receive an intravenous injection for signs that the drug is working or is causing undesired side effects. Also, the effect of a drug given by this route tends to last for a shorter time. For the intrathecal route, a needle is inserted between two vertebrae in the lower spine and into the spine around the spinal cord. The drug is then injected into the spinal canal. A small amount of local anesthesia is often used to numb the insertion site. This route is used when a drug is needed. However, rapidly or local effects on the brain, spinal cord, or the layers of tissue covering them. On meninges, for example, to treat infections of these structures. Anesthetics are sometimes given this way. A few drugs are placed under the tongue, taken sublingually, so that they can be absorbed directly into the small blood vessels that lie beneath the tongue. The sublingual route is especially good for nitroglycerin, which is used to relieve angina, that is, chest pain due to an inadequate blood supply to the heart muscle, because absorption is rapid and the drug immediately enters the bloodstream without first passing through the intestinal wall and liver. However, most drugs cannot be taken this way because they may be absorbed incompletely or erratically. Many drugs that are administered orally can also be administered rectally as a suppository. In this form, a drug is mixed with a waxy substance that dissolves or liquefies after it is inserted into the rectum. Because the rectum's wall is thin and its blood supply rich, the drug is readily absorbed. A suppository is prescribed for people who cannot take a drug orally because they have nausea, cannot swallow, or have restrictions on eating as is required after many surgical operations. Drugs that are irritating in suppository form may have to be given by injection. Some drugs may be administered vaginally to women as a solution, tablet, cream, gel, or suppository. The drug is slowly absorbed through the vaginal wall.
Tough.
$135. Call it a day.
Okay.
So my apple's going down, my pot is going up.